CNA oxygen therapy positioning. Welcome to the quiz. Question 1. You are caring for Mr. James Patterson, a 72-year-old male patient who uses a cane for ambulation. You are assisting him with walking to the bathroom. You need to ensure his safety and the correct use of the cane. Based on proper ambulation techniques with a cane, on which side should the cane be held to provide the best support? Option A, on the same side as the weak or injured leg. Option B, on the opposite side of the weak or injured leg. Option C, in either hand, it does not matter. Option D, the patient should hold the cane with both hands. The answer is B. A cane should be held on the opposite side of the weak leg to provide a wider base of support and reduce stress on the affected joint. Option B is correct. Option A is incorrect. Option C, it does matter. Option D, canes are designed for one hand. Question 2. You are reviewing the policies regarding leaving patients unattended, especially those who are confused or at risk for falls. You understand that patient safety is the priority. Based on standards for supervising patients and preventing harm, which statement accurately describes when it is acceptable to leave a patient unattended? Option A. It is acceptable to leave a patient unattended for any reason, as long as you are not gone for more than 5 minutes. Option B. It is okay to leave a patient unattended for short periods if they are alert and oriented to person, place, and time. Option C. It is never appropriate to leave a patient unattended, except when you are called away for emergency situations involving another patient. Option D. It is acceptable to leave a patient unattended for extended periods if family members are present in the room visiting the patient. The answer is C. Patients should never be left unattended if they are at risk, and even alert patients should not be left alone in unsafe situations. The best answer is C. It is never appropriate except in an emergency where you must respond to another patient in crisis. Option A is unsafe. Option B. Even oriented patients can fall. Option D. Family presence does not eliminate the need for staff supervision. Question 3. You are attending an educational session about healthcare ethics and patient rights. The instructor is discussing the concept of patient autonomy and what it means for healthcare providers. Based on understanding of ethical principles in healthcare and patient rights, which statement best defines patient autonomy in healthcare settings? Option A. Patient autonomy means the hospital's right to make all healthcare decisions for the patient regardless of what the patient wants. Option B. Patient autonomy is the patient's fundamental right to make decisions about their own healthcare, including the right to accept or refuse treatment. Option C. Patient autonomy refers to the family member's authority to override the patient's wishes if the family disagrees with the patient's decisions. Option D. Patient autonomy is the CNA's responsibility to direct and control the patient's activities and medical decisions based on what the CNA thinks is best. The answer is B. Autonomy means the patient has the right to make informed decisions about their own care. Option B is correct. Options A, C, and D violate patient autonomy. Question 4. You are working the day shift when you observe something concerning. While helping a different patient, you overhear a nursing assistant on your unit speaking harshly to a patient, using disrespectful language, and treating the patient in a way that is clearly disrespectful and unkind. The patient appears upset and distressed by the interaction. The patient has asked you not to report the incident, saying they do not want to make trouble. However, you believe this behavior is inappropriate and potentially harmful. Based on your responsibility to advocate for patients and maintain professional standards, how should you handle this situation? Option A. Say nothing about the incident to anyone, respecting the patient's request to remain quiet even though you witnessed inappropriate behavior. Option B. Only report the incident to other nursing assistants during your lunch break, but do not tell any supervisory staff or the charge nurse. Option C. Report the incident to your supervisor or charge nurse so that it can be documented and addressed through appropriate channels, as this is your responsibility. Option D, confront the staff member immediately in front of the patient and other staff members and tell them that their behavior is unacceptable. The answer is C. Patient abuse or disrespect must be reported, even if the patient asks you not to. Option C is correct. Option A allows harm to continue. Option B is gossip, not proper reporting. Option D, confronting the staff member publicly can escalate the situation and is not the proper chain of command. Question 5. You're assisting with hygiene care for Mrs. Nancy Foster, a 65-year-old female patient. The nursing staff are emphasizing the importance of comprehensive hygiene care and its role in overall patient health and well-being. When considering the purposes and goals of providing comprehensive patient hygiene care, which statement most accurately describes the primary goals of hygiene care? Option A. The main goal of hygiene care is to punish patients for being ill by forcing them to bathe even if they do not want to. Option B. The primary goals are to maintain cleanliness, prevent infection, promote comfort and relaxation, provide an opportunity to assess the skin, and maintain the patient's dignity and sense of well-being. Option C. The main purpose of hygiene care is to follow the hospital schedule exactly regardless of patient preference or individual needs. Option D. The primary goal is to make the patient tired so that they will sleep for extended periods and require less care. The answer is B. Hygiene care promotes cleanliness, infection prevention, comfort, skin assessment, and dignity. Option B is correct. Options A, C, and D are incorrect and disrespectful. Question 6. You're assisting Mr. Christopher Wilson, a 70-year-old patient, with eating his lunch. As you observe him eating, you notice he is having some difficulty with chewing, seems to be taking very small amounts of food, and is chewing very slowly and carefully. He mentions that swallowing seems difficult sometimes. You are concerned about his ability to swallow safely. When assisting a patient with eating, which observation is most important to report to the nurse? Option A, how much the patient actually likes the taste of the food on his plate or whether he thinks the food is good. Option B, the color and appearance of the food on the plate and whether the portions are an appropriate size. Option C, any difficulty with chewing, swallowing, or signs that could indicate aspiration risk or difficulty managing food. Option D, whether the patient finishes all of his entire meal or leaves food on his plate. The answer is C. Difficulty chewing or swallowing is a critical observation that may indicate dysphagia and aspiration risk. Option C is correct. Taste, food appearance, and meal completion are not urgent safety issues. Great job! Don't forget to subscribe. Bye!